that people think about when they hear schizophrenia is they think of hallucinations, they think of paranoia, they think of people with the tinfoil hats on their head. And these are things that can happen. However, there can also be what we call negative symptoms about schizophrenia. These people might look depressed. Their face will be really flat. They won't have any motivation. They might just sit on the couch and stare. They also might have problems getting their words out. Like they might look like they're thinking, but they can't get their words out. They'll find that their thinking is what you might call disorganized, and their thoughts aren't coming together like they normally would.
So the difference between that and depression, which is far more common.
Correct. Depression is, so schizophrenia is considered a thought disorder. It messes with your thinking, it messes with your reality. Depression is considered a mood disorder where it colors how you see the world. And part of that is undergirded by biochemical processes in the brain. So you don't have quite the right balance of chemicals, and you're convinced that everything is doom, gloom, you're guilty, you're hopeless, you're a burden, low energy, those types of things. But it doesn't change your thought process other than coloring how you see the world, but your reality remains the same.
Okay, versus a different,
schizophrenia, where you have a different perception of reality.
Alrighty. Dr. Corey Walker, thank you so much. And this is maybe even the best part of our conversation because we're not done. It will continue on our KHOU Facebook page, which means that you have an opportunity to ask your individual questions to Dr. Walker. She'll be here, so just click on over if you want to do that. Back to you, Brenda. Okay. So I think we're here now on our Facebook Live page. Is that correct? Okay, all righty. So this is an opportunity for us to interact with our Facebook friends, and I'm going to go ahead and punch up my our Facebook feed here real quick so that we can go ahead and see if there are questions from folks out there. But, you know, we can start this conversation. We were talking a little bit earlier about the differences in, say, from schizophrenia to depression, which is fairly common. And I think a lot of times people feel like, oh my gosh, I'm the only one, no one understands. But mental health illness is actually relatively common.
It is.
Talk to us about that.
It is relatively common whether someone's suffering from depression or anxiety. Anxiety is really common versus a substance use disorder versus a thought disorder or a mood disorder. So the thing that mental illness has in common with all the mental illnesses have in common is basically our brains, which we use to understand our brain, start giving us bad information. It might tell us that the world is dark and gloomy. It might tell us that everything is coming to an end and we need to worry. It might tell us that the FBI is following us. It might tell us that we need alcohol as much as we need air to live. That's the way mental illness kind of tricks our brains into having unhealthy information going to our minds. We use our mind to understand our brain, which is generated by our brain. So you can see the problem here when the brain gets sick, because the very thing we use to understand our brain
is giving us bad information.
Right, is made by our brain, which is sick. So what you have to end up doing is challenging yourself to question your perception. That is really hard because a lot of us count on our brains to tell us everything about our environment, everything about our situation, and how to act. And so if that information is bad, it can lead to awkward behavior, odd behavior, yet at the same time it can be hard to trust other people because they're telling you what your brain's telling you is wrong, and that's probably never been anything you've experienced before.
You know, this is so I'm just taking a look at some of the questions here and hoping that we might be able to get, you know, a couple of interesting questions out there. Let's see. Ellie is asking, if a person is diagnosed with PTSD and anxiety, do you need a psychiatrist or a psychologist?
So, PTSD and anxiety are both on the anxiety spectrum. So if you have PTSD, you have anxiety. It might only be about your traumatic event, or it might be more generalized. So the question is, do you need a psychiatrist? That really depends on if you're using medications to manage your anxiety and managing your PTSD. If you are with PTSD in particular, we don't have FDA indicated drugs for PTSD. So psychiatrists will do some things what we call off-label to maybe help with some of the symptoms. Your general practitioner or your internist is not going to want to do that. And it's just kind of some specialized knowledge, and nothing against it. It was just specialized knowledge. You absolutely want to have a psychologist or a therapist, and you really want someone who specializes in trauma, people who can help with cognitive processing therapy, people who can help with exposure and response prevention, people who, yeah, go ahead.
Well, I was just going to say, and I don't know, stop me if I'm wrong, but if you're doing therapy that's maybe talk therapy that doesn't require some kind of a prescription, do you need a psychiatrist, or can you maybe go at a counselor?
You can work with your therapist.
Okay.
And then if your therapist really thought, hey, you know what, I think you really need some medication to help with this. I think you're fighting really hard, but you're fighting against your biochemistry. They'll tell you to go to a psychiatrist. Ideally speaking, you'd like your therapist to recommend a psychiatrist that they work with, so that they can collaborate. Not that they're always talking about you, but if the psychiatrist is thinking about starting a medication, they can let the therapist know, and the therapist can give feedback to the psychiatrist. Yes, I'm seeing a benefit. No, I'm not. That type of thing.
You know, R.A. Segovia is asking, does bipolar or dual progress with age? So does, I guess, bipolar diagnosis, does it get worse as you get older?
Typically not.
Ah, interesting.
Actually, typically it gets a little less
Severe?
severe. You might have fewer manic episodes. It might be less energetic than in the past. So typically not. Sometimes people remain the same, but oftentimes it tends to what we call burnout, where it gets less pronounced, fewer mood swings, and less energy behind the mood episodes.
So people are asking, how and where do you get help? And the other, of course, component to that is whether or not you have insurance.
Right.
What do you, in a practical sense, suggest?
Okay. If you're wanting to use insurance, there's going to be a limited group of people who are going to take insurance.
Okay.
There are different low-cost programs. If funding is an issue and you don't have insurance, the Menninger Clinic has a charity program. Also, the Harris Center has benefits. Legacy has benefits. So there's many more that I am missing in our community that provide care. If you are of means and can pay out of pocket, there are quite a number also of very good practitioners. Simply because someone takes insurance or does not take insurance does not make them a higher or lower quality provider. Those mental health professionals really are determined by their skill and by their education and how well they keep up with things and how well, most important, they connect with you.
There you go. I think that's probably I'm betting that is the biggest component.
That's the secret sauce.
And I should tell folks that we do have on our Facebook page and at khou.com rather a link to any number of resources for folks who want to explore therapy, treatment, and assistant options when we're talking about mental health. You know, and some of the folks here are sharing some of the same names that you brought up. You know, let me see if I can. You know, somebody else had a very interesting question. What about an individual who has had a long history of drug use, you know, a decade or more, and even though maybe they are clean now, can that long-term drug use impact your mental health?
Absolutely. So there's some of the practical issues of any brain damage. Is your brain making chemicals differently? You know, if you were using downers, does your brain not make as much relaxing chemical? If you were using uppers, does your brain get a little burned out? So there's those hard, concrete things. That's actually pretty rare. It's amazing how resilient the human brain and body are and how much they can tolerate, how much we abuse them. But there are other things that happen. For example, a lot of times whenever someone started drinking and drugging heavily, that is about where their maturity stopped. They end up missing out on opportunities to endure discomfort. That helps us learn other coping skills that help us kind of mature into the role we're playing. So a lot of times if someone's had long-term drug use, they might end up being like developmentally a little behind.
Interesting.
One of the added stresses then is you're growing up in public.
You're not growing up,
With your
you're not
peers.
really grown up
Right.
because of the drug use, and then when you're, maybe if you're done and you're trying to get healthy again,
Right.
now you've got the growing up to do.
Exactly.
Yeah, and it's in a public situation, and that can be difficult.
Yeah, people know, you know, if you're 40, but you're functioning like a 17-year-old, because that's when you started using heavily, it stands out that you're a little bit different than your fellow 40-year-olds, usually in terms of emotional dysregulation, because that emotional up and down is what we managed with the drugs and alcohol. That's how we took care of it.
The
so we don't have any
self-medication.
other skills around that, and so then it stands out a little bit as you try to gain those skills.
There's a lot.
So
yeah,
it's
a lot
important
of
to have
moving parts.
compassion. Compassion and empathy, both for the sufferer, for themselves, but
Mm-hmm.
also for the people around them. Especially because it's easy. If it's been 10, 12 years of heavy using,
Mm-hmm.
it's very easy to be very frustrated and very angry, which is really, that's healthy and normal, but something to work out in your own therapy, not on the person who's,
street.
right, at the
Yeah.
street, or on the person who's suffering.
Okay. You know, I'm going to give you one last question here, and just take a quick peek to see if there's anything else that we might share from our Facebook friends here. But what do you do if the person that you know, your friend, your loved one says, no, I'm fine. I don't need any help.
Yep. This is
How are you going to handle that?
Right. This is very, very common.
Mm-hmm.
So, one thing that I think is really important is, one, don't dispute them.
Mm-hmm.
Don't get in a fight about what's real and what's not real.
Mm-hmm.
Don't tell them that what they're feeling is not what they're feeling. Don't
They
tell
are
them,
feeling it.
Right. And don't
Yeah.
tell them their reality is not what they're experiencing, because it probably is.
To them, yeah.
So what's more important is to validate. You know, I can understand with this depression why thoughts of suicide might come to your mind. You feel so hopeless. And I can understand why that might happen, but maybe we could try some other options before we get to that option. You know, would it be so terrible to see a therapist? You know, I mean, if you're going to die anyway, why not give that a shot first? And sometimes that can get, it's a little, you know,
Kind of a reverse
right,
psychology,
yeah.
sort of an
It's
interesting.
a little provocative,
Yeah.
but it's like you're not fighting with them about that dread and that feeling. If someone says, you know, the FBI is monitoring me and they are after me, I imagine that's terrifying. Because think about if the FBI were really following you.
You
I'd
would be terrified,
Terrified. You know, like, I'm not a spy. I don't do illegal things. I'm not running a drug ring. Why would the FBI be following me? You'd be scared. So I imagine that's really terrifying. What is that like for you? I wonder if anybody could help us with this. I'm not an expert in how to deal with the FBI.
Interesting.
So
All
some
right.
of these things, and kind of giving that validation, letting people build an alliance with you. Now, if they get to a point where they're imminently at risk of death or imminently at risk of harming someone else, you need to call the police.
Yep. And we know that there are mental health units with Harris County and, you know, HPD, that they are working to expand even here locally so that they can deal with folks, you know, who have this particular issue. Dr. Corey Walker, thank you so much for joining us. Always insightful to hear from psychiatrists, from therapists. And if you have a question, and we didn't get a chance to address it today, no worries. Actually, next week we were going to begin our series, Revisit, our Be Mindful series. That'll start on Monday at 4 o'clock on our 4 p.m. news, and that will run, you know, all the way through Thursday. And we will have other Facebook opportunities next week in the afternoons to speak with other doctors, like Dr. Walker here, where you can ask your questions there. So thanks very much for joining us, and we will see you again next time, as I like
Thanks
to
for
say.
having me.
Thank you. Ciao.